with the doctor.
No, they also did prolactin, which is the hypothyroid blood test on me, and they said that it was elevated. This was probably about 7 months ago. I just recently had that tested, so I haven't had the results yet until next week on the prolactin.
My recommendation is as follows. You need to stay as much as possible from bad news. And if you go to a place that constantly delivers bad news, there's no other option. You're going to have to get some bad news. That's the expertise of that part, of that side of the medicine. Their expertise is to give bad news. You are not working. That's what we're here for, to find out that you're not working. So you do hundreds of tests, at the end you have to find something on everybody. So I'm not discounting it, but for example, I had many people, many couples where the woman had high prolactin. And they never conceived for the last few years with IVF or everything. Like let's say you have high prolactin and you conceived 2 months ago. As far as modern medicine, there's absolutely no difference. High prolactin, let's say it's the same number, it's exactly the same, but it's completely not the same. If you conceive, and the state that your heart is in, that I described briefly before, is completely not the same as other people, even if the prolactin level is the same. Our purpose here is not to get the numbers right. Like the FSH needs to be right, the AMH needs to be right, the prolactin needs to be right, the thyroid needs to be right. That's not the purpose. The purpose is to get pregnant and have a healthy baby. This is why we're here. Even if the prolactin is high, if you get pregnant and you get to have a healthy baby, I'll take it with the high prolactin. It's not about the prolactin. It's about if we can have a healthy baby or not. And I explained to you what I think is needed. This 1, 2, 3. The body needs to be without pains, the unification needs to be strong, the heart needs to be as harmonious as possible. These are the 3 things that I see. This is my opinion, right? It's not everybody's opinion, it's my opinion. This is what we need to get to be successful. And success I had many times, hundreds and hundreds of times, just by myself, but I also have many students, and they had many pregnancies. I don't know how many. There's a lot of that help going around. A lot of people succeeded before. Like I'll share with you a story. I gave a seminar in Brazil last year, and there was a practitioner, and there were a couple of patients came in. They brought a few patients for the last day. 2 of these patients got pregnant after they just came to the seminar. And then the practitioners followed what they just learned in the seminar. They just learned it. What I explained to you today, they just learned it. They're doing Chinese medicine, but not this. They just learned it. The patient felt really confident all of a sudden. They gave them this little cinnamon and ginger stuff. And 2 of these patients got pregnant. But the story is, one of these practitioners, she's I think 45 or 46. And as we are going to lunch, in the middle of the seminar, at the middle of the day. And she said, can I talk to you? I said, sure. And she said, look, I've been trying myself to get pregnant for a few years, but I can't. What do you think I should do? And I said, look, work on the heart is the best thing. Get some unification herbs, it's good. Her patient got pregnant. Her patient was one of these 2, got pregnant. But then she emailed me, and that was last year already. But then she emailed me a few months ago. She got pregnant herself. She's not taking herbs, but she took my little fertility book. I don't know if you have a copy of it or not. And she said, it makes so much sense to me. I read it 5 times. Like she's convincing herself more and more and more until she did it.
Yeah.
2 days ago, I had a patient. She's trying to get pregnant again. She got pregnant with me like 2, 3 years ago, 4 years ago. And I was talking to her about the same thing. And she then reflects back on when she got pregnant with my help a few years ago. She said, you know, when I got pregnant last time, I was watching your testimonial videos every day, over and over and over again. At the end, she got pregnant. Now this is, I'm not to say that my book is anything special or the videos are anything special. It's about people working out their heart to get more power, And this is the opposite of what you just said. I'm waiting for the test result, prolactin. It's the opposite of trying to get discouraged. Like, we need more of these things to get more power, more power. And this makes miracle. This, the amount of energy that we have in there, in the heart, and we can get out if we just have the chance for it. It's tremendous, you know. And especially in your case, where you got pregnant recently, the levels are not really very low. The examples that I just gave you before were people that were much less energy than you. So that they never happened. It's not like they had, and again, I'm saying, I know that it's sad, the miscarriage, but it actually means the energy levels are high. We're not that far off. We are in that junction that if I choose to go that way, and I start getting bad news, and it hammers the heart, it actually becomes impossible. You know, like then the doctor's prophecy of like, you're too old, it's not going to work, is going to materialize. But we should just not walk that path. We should go the other way to a place that I get stronger, happier, kindle the fire with my husband, you know, that kind of thing.
Right.
And so I shared with you a few stories, not in order to, what's the word I'm looking for, not in order to flatter myself, but just to show you people that worked their heart, that were in worse, much worse situation than you guys are. You know, they made it still. It's just that I point to everyone, I said, stay away from all this bad news. They say it's like the truth, we need to find the truth, but it just puts the person down. You just depress the person and it sucks the energy out of the heart, and this is a very, very wrong path to go. You know, I mean, I know that it sells, I know that it's good for business, it's just not good for people. So this is my recommendation about acupuncture and where the heart should be. You should just go back, reflect on that old lady I told you about. She said, yeah, well, what's the big deal? Drink a couple of glasses of wine. It sounds silly, but she's very wise. She's 85. When you get older, you get smart. It's like, just get the heart going, get the fire going. And this, you know, you could use some physical help, some herbs, get some more energy, but it's definitely in the heart, there's a lot of potential.
So, your opinion, I mean, we stopped having wine back in April, or whenever it was, just because that was a recommendation, hey, it's going to cause a problem with you. We'd get pregnant, and we'd have 1 or 2 glasses a night, and maybe we had too much at some of the nights, you know. But is 1 glass going to kill anybody? I mean,
I don't know if you noticed the pattern. You know, these people that cater to our fears, they always say what we do is wrong, what we want is not good. Then they give us stuff that tastes disgusting and makes a side effect, but that's good for you. I'm not sure if you realize what the pattern here is. But I am completely against it. You know, like when I did my training for my doctoral program, I spent like 1 year at an IVF clinic, few hundred hours. The doctor, I love him, is a beautiful guy. But I remember every evaluation, I used to sit with him, with patients, saying, how is the IVF clinic going on? What's going on there? And there was a lot of talking about surgeries, laparoscopy, steroids, antibiotic, drug stimulation, injections. A very miserable state of affairs. But at the end, he would always conclude, but I recommend that you don't drink coffee. So for, you know, for an hour you hammer the people with all the stuff that's going to make their body and their heart really miserable. At the end, they really like to drink a cup of coffee. You tell them, you take it away. So again, it's different than if you talk about wine, getting intoxicated. Let's say I'm getting drunk. As soon as you get intoxicated, and also with coffee, you drink 10 cups of coffee, you start shaking, this is a problem. It's a problem to get intoxicated, or get dependent on something, or get addicted. This is a problem. But people, you know, they wake up in the morning, or they're a little tired in the afternoon, they drink some hot coffee, they really enjoy it. What's so bad about feeling happy a little bit? Or drinking a glass of wine, the husband and wife sitting, you know, Again, I'm not talking about let's get drunk. We're not teenagers here anymore. You sit on the balcony, you look at nature, you sip a glass of wine after dinner, and it makes the heart very passionate. What's so bad to give some life to people? Why does it have to be take the drugs, take the pills, and don't, you know, I mean, for me it's like, maybe I'm a little bit too extreme about it, just wanting to have fun, but I don't think so. I don't think, I'm not for getting drunk, I'm not for getting abusive of drinking and eating stuff. But it's like, you need to be healthy, you need to do things. But you know, I told you, I took my kids, so what? We go eat one time in a Cheesecake Factory, whatever. I had salad with falafel, whatever. And then they had something, and they had a cake or something. So what? Like, I don't have to be, normally we eat really healthy. But it's more about the heart. It's not about, you know, can't this, can't that. And some things are really bad. So if you ask me, well, can I do some street drugs? I would say definitely not. Right? So there's a limit. It's not like do something of everything. It's not that hippie thing. Yeah, let's just do something with whatever. Something are proper. To warm the heart, to be together. The wine, there's no problem. They just artificially made a culprit out of it. You know, drinking wine has been done for a long, long time. It's not like a modern invention. People getting drunk and having problems, it's also a problem we need to be aware of. But there's, you know, there's responsibility. We're adults, we're not teenagers. I mean, I have nothing against teenagers, but they tend to overdo things and stuff. You know, but I definitely for doing things that warming up the heart. And stay away from all the negativity and people that want to give you the truth, quote unquote, and meanwhile they kind of suppress you and suck the life out of you. That's my recommendation, especially when it comes to fertility. You know, many times it's different in medicine. Let's say you have a heart disease, you're about to get a heart attack and die. It's a different talk. You go, you have to get the bad news, you have to do the surgery, that will save you. And I'm okay with that. That's the proper thing to do. With fertility, it's very different. It requires the heart to be really happy, really strong, and the person normally are not sick. People start to tell you that you're sick despite that I feel great. Because you're trying to get pregnant, the unification is a little weak, the energy in the egg is a little short, but they don't know it yet. The modern science doesn't have this knowledge yet. So they start saying your thyroid, this, prolactin, all kind of numbers. But originally you're not sick. All of a sudden they make you sick. Like they put all kind of diagnoses on you and stuff. Sicken you up. I don't know if there's a word in English for that. But it needs to be complete opposite. You should be very proactive about trying to get healthy, but at the same time, and more important, try to get happy. You know, and there's a balance there. That's why I said, look, wine is not good. But if I drink a glass, it's going to make me really happy. That happy is more important than what people say, not health. And it actually has nothing to do with health. You know, I'll tell you another story. I had one of my students. I have a school online with students, and one of them, her grandmother in France, she's 95. That was a few years ago. She was 95, and her health started to deteriorate. She's 95. So her granddaughter is asking me in the email. She said, look, my grandmother's health is deteriorating. Every night for the last 70 years, she's drinking 2 glasses of wine. Should I tell her to stop drinking wine? You know, you just reflect on it in your stomach and you know that this is like, you know, it's a fatal mistake. It's like, but they told us that wine is not good, you know, you will lose the center. She likes it, it makes her happy. The happy keeps her alive. Not the diet, not the vitamins. The happy keeps her alive. You take that happy away, it's a very bad end. You know, so just think about it. Like making the heart powerful is actually more important than if I eat the sugar or a cake or not. Even though it's not good to eat a lot of sugar. But the heart, everybody ignores it. Everybody gets bad news all the time, and they said, okay, I eat salad. I eat organic salad, but the heart is, everybody gets them depressed. And So just need to put it in perspective. And straightening up the heart is very important, and it's very helpful here. It might be break it or not. I mean, make it or break it.
So get that heart, get our heart back together, get unified together, and we do conceive. Then, as far as taking what we need to take, like the progesterone and stuff like that, we definitely need to go with that. Obviously, right?
You decide. You decide what you think. It's not really for me. I mean, I'm not a guy that like all kind of artificial assistance. I just want people to get stronger. Now, some people, after they get pregnant, if they get progesterone, it does help them. As I told you at the very beginning, for those people who do IVF, all of which take progesterone, the ones who do get pregnant, for many of them, the progesterone didn't help. The way I look at pregnancy, there are two parts. One is when the sperm and the egg get together, there's enough unification in the embryo, like enough recharging ability. The second part is that the mother is strong, her heart is happy, and now during the pregnancy she can nurture it really well. But there's no mention of progesterone here or estrogen. It's distinct. Either we got really healthy and strong before conception, so the embryo is strong, and then the mother gets really encouraged, she eats healthy, she stays away from stress, and she rejuvenates as much as she can. This is the success secret, the way I see it. Again, it's just my opinion. It's not like I'm the New England Journal of Medicine. I'm just giving you my opinion, how much I was able to think about that. My job today is just to share with you my opinion. You go back, you reflect on it, it makes sense, doesn't make sense. But again, if my experience was all the people that I saw who took progesterone, none had miscarriage, I would have a very different opinion. I would say, look, it looks like it really, I don't know anything about it, but it looks like it fixes the problem. But I'm not sure that I see that reality. I mean, I know that people scare you, you don't have enough progesterone. It's just that the facts are not supporting it. The fact will be that everyone who got pregnant and takes progesterone doesn't suffer a miscarriage. This will be the fact. But that's not the reality. So again, I don't know. Some people, it might be that they really need that. So I don't know if you need it or not. And it's up for you to do it. But I do know, and again, it's not so very easy to say it, but I do know that always, no matter what the situation is, there's only one really proper thing to do. In other words, if someone really needed the progesterone and they took it, they make it. If they didn't need it, but they take it anyhow, they don't make it. It's not like it doesn't matter what I do. So making the decision, is it really right for me or not? I think it's a decision for each person to make. It's not my decision. And the way to do decisions more and more proper is to start working on the heart. Because then people, and I just share with you personal, I'm not looking at other people's stories, but like my own story. Like when I took one of my kids when they were a baby, 1-year-old, took them to pediatrician. Normally I take them to pediatrician to sign forms for school. And then, the kid is healthy. And then the doctor checks the ears and says he has a severe ear infection. So I look at the doctor, how severe infection? The kid is 1 or 2-year-old. Sleeps well, looks happy. You look at the eyes, you see they're not sick. And she said, here, let me show you. She put the scope, she put it on the computer so you can see the live video. And you see it's a little red and bulging. And then she started hammering me. She doesn't know what I do and how I think. She says, look, if you don't take antibiotic, the infection might go to the throat, then to the heart. The kid might die. You see the pattern, like how she tried to scare me, but I'm much more confident than that, and I've been through it a lot. So I'm different than the typical parent that she sees. I go home, I look at the kid. I told her, you know what, I'll give the kid some herbs, I'll be back in 2 days. So I went home, I said, this kid really doesn't need herbs because he's healthy. I said, you know what, maybe I'll drip some hot water in the ear. So I dripped some hot water in the ear. I didn't give any herbs or anything. We went after 2 days. And she said, wow, a miracle, there's no more ear infection. This decision making, if to do it or not, it's not that I'm against antibiotic. If to do it or not, it's in the person's heart. The more I'm more insecure, they scare me and I start doing the wrong thing. The same thing with choosing if to do progesterone. It's not that it's wrong or right. I just, when I get to this, I reflect, my body said, I could use this help. Or no way, there's nothing that I need in my body. You know, that kind of thing. And normally, I know what I say, people are not accustomed to it. They are used to, the doctor will tell them. I don't know anything. You know, I'm not a doctor. They'll tell me, this is, I think, is a bad mistake. I'm looking at myself as a patient. I work on myself as a patient. I want to try to make the right choice. That's why when I told you, when you drink the herbs, you're going to like it. This is that choice. You drink it, I like it. It's not a very difficult choice. The difficult choice is like, it's disgusting, I want to throw up, but the doctor says it's good for me. That's the difficult choice. It's like your mind has to overcome your heart. Your heart knows it's bad, your mind said it's good. You know, but I don't believe in that separation of mind and heart. It's like, if it's good, it's good. If it's not, everything has to conform. My heart, my mind. So again, with the progesterone, I cannot tell. I know we started the conversation like this. The doctor with the sticky note, maybe they overdid it, they overlooked it. Right? Was that at the beginning of the session, or am I confusing with another patient? It was with you, right? Yeah. And it could be. But it could also be, if you take the herbs for a few months, it will be a very different situation. And maybe you have needed it before, but you might not need it in the future. Like when we get to that bridge, you just reflect on it. If the fear is what makes you make the decision, oftentimes it's wrong. If the confidence and knowing it, and it might be, yes, I need it, and I know I could use this help, then it's right. You know, then the heart tells us to do the right thing. You know, that's at least my belief. All right.